and take better care of our bodies, our minds, and our souls. We ask special blessing on the bereaved at this time, that they feel your comfort. We pray for the brokenhearted, that they too may be uplifted. And we pray for all of our families. Meet our needs, our individual and our collective needs, as only you know how. Thank you for the leadership of this church that have provided these sessions. Pastor Tull, the media, everyone who has a part in making this possible, and may your name be glorified. Bless our session today and give a special blessing on Dr. Gibbons as he presents, we pray, and we thank you in Jesus' name, amen. Okay, so everyone's ready. They're getting a little tougher. And in some cases, the answers may not be as simultaneous or as you expect. Sometimes you have to go back a little. Okay, starting. Number 1, the whole plant offers more of nature's safeguards and is safer and gentler than isolated compounds found in many pharmaceutical drugs. True or false? That's true. Number 2, an individual must soak in bath of herbs for a minimum of 20 minutes to hydrate the skin before they can begin to absorb the medical qualities of the bath. That is false. Why? It's 15 and 20 is above, okay? Although 20 would do fine, but it says minimum of 15. 3, decoctions are made by simmering leaves and flowers for 10 to 15 minutes before straining this herbal preparation. False. Why? Right, not leaves and flowers, rather it's roots and barks. Right, number 4, syrups are a pleasant way to prescribe herbal medicine for children as they are sweet and easy to take. True, we see that in traditional medicine. Number 5, for acute conditions like the flu, herbal preparation is usually taken 5 times a day or every 2 hours. That's true. Number 6, essential oils should always be diluted before application to the skin. True. Salves, number 7. Salves serve as a carrier for medical plants components. That's plants possessive, S apostrophe. Salves serve as a carrier for medical plants components which promote healing by penetrating the skin. That's true. Number 8, raw, and I am assuming that wild might be referring to the raw. Raw honey is an effective topical treatment for treating cuts, leg and skin ulcers, abrasions, gangrene, dandruff, and diabetic ulceration of the foot. True. Number 9, flaxseed can improve mood disorders, lower blood pressure, fight against breast and prostate cancer, reduce hot flashes, and lower cholesterol levels. That's true. Number 10, ginger is not effective against morning sickness, painful menstruation, and heavy menstrual bleeding. True or false? That's false because ginger is effective under these conditions. Number 11, garlic positively impacts the respiratory, digestive, immune, and cardiovascular systems of the body. That's true. Number 12, thyme is effective as an antiseptic gargle for inflamed gums and throats and as a topical wash for wounds and bites. That's true. Number 13, nettles are good for common respiratory issues like bronchitis, asthma, mucus conditions of the lungs, and chronic coughs. That's true. Number 14, Charcoal is not effective against toxins such as lead, DDT, and the rest. True or false? Why? Because charcoal it absorbs toxins. Number 15, lavender essential oil, when mixed with equal parts tea tree essential oil, is said to rapidly reduce blemishes. True or false? True. Actually, be careful. Rapidly is true. Number 16. Essential oils capture a plant's therapeutic properties and have an herbal effect similar to the original plant, but are up to 60 times more concentrated. True or false? Why is it false? To 100 times, not 60, 100 times, even more so. Number 17, herbal powders are used to relieve skin rash, diaper rash, and fungal infections of the skin. True or false? That's true. Good. And number 18, a body rub with the addition of aromatic herbs such as basil, rosemary, lavender, thyme, and watergreen can be effective in decreasing muscle spasms in the chest, bronchial cough, back, skeletal muscle pain, and stomach, colic, and constipation. True or false? True. So, yes. So as you were asked before, you put the total number 18. We put the total number 18 at the top of the page, and over that you put the number that you got correct, and we pray that everybody got 100%. Okay, you're honest. Okay, so with no further ado, I'd like to introduce the man who is a preventive care specialist, works at BWalk, has studied hydrotherapy and massage therapy, is a registered dietitian, and now the conference director in health for the Seventh-day Adventist Conference here in Bermuda. With no further ado, you can hear my husband, the presenter, Leonard Gibbons.
Good morning, everyone. I trust you had a good night. Today is great. If you go outside in Bermuda, I don't know where you are from around the world, but it is beautiful today. Isn't today Valentine's supposed to be? Yes? Am I right? Yes? It's another day, but it's a day that people, and so for all of you and to my wife, I wish you all the blessings and happiness and joy. All right. Love you very much, Rosie. Okay, let's get going. As soon as the slide comes up, we are going to get moving today. All right, today is more about herbal medicine. And for those of you who are here, I put my phone number, actually my work phone number down the bottom there. If you have health issues or you know someone who does, you would like to encourage them to try a more natural approach, go right ahead and take that number. If you are overseas and you want to make contact, see the email there, newstart1158@gmail.com. I also have cards right here. And for those of you who are coming in, those of you who are here, you can take that and share it with others. Okay, wait a minute here. All right. Well, before we go into herbs, I just want to put it in its context. We talked about 4 steps to reversing disease, correct? So first of all, we determine the cause, right? And the cause is usually lifestyle factors, right? All right. And 2, we what? We want to change the condition. If you look at the condition, then you can more readily recognize what are the causes. Because even though we think of all the remedies, but there are some may be specific based on the particular condition, which is a fire alarm, right? Which is letting us know where it is and what we, not necessarily telling us what to do, but if we understand, we will know what to do. For example, if diabetes is an issue, it tells me something. I know what's happening, right? something's happening, it's too much fat, oftentimes in the cells, or the muscle cells, and because of that, the insulin doesn't work well, and so it's getting the fat out, not so much getting rid of all the sugar. So there are a number of factors. Okay, we change the condition, and then we what? We correct the wrong habits. So we adjust and we follow the healthy habits, right? We need to exercise more, we need to change our eating, we need to do all those things. Now, when we've done all of those things and it still seems like what? Something's not working. Well, maybe you need to add something else to it, right? And so you want to assist nature to provide some other tools to help it. Hydrotherapy, we're going to address at another time. Today, we're going to look at herbs. Okay? We may say a little bit about fasting and some of those others as we go along. Today, we're looking at plant medicine. All right? Let's get right in. Okay, plants have a source of medicines since the fall of mankind. If you look in Genesis 3, verse 18, God put a curse on man, and he said that the plants would bring forth like thorns and what? Thistles. And when you think of thorns and thistles, even thistles, what do you think of? You think of something that's going to what? Something's going to hurt you, right? Right? It's got all of these pricks. But you know that the thistle family actually has a healing property? And they are part of herb family that actually helps the liver cleanses, right? So even in giving us thistles, God gave us something to help restore us. Isn't that amazing? So you will eat the what? The herb of the field. Now, why weren't the herbs added before the fall? Well, logical conclusion, right? If you didn't have it before, you didn't need it. If it was given to you right after, then you what? You need it. So in our simple state, God has provided medicinal qualities in the plants that bring about healing. Isn't that amazing? I don't know about you, but our God is good. And the leaves of the tree are for the healing of the what? Nations in Revelation 22:2. So in the new earth, some suggest that we, of course, when we arise and those who are dead and remain, who are caught up with those who were resurrected, we will be at what height? We will be at 15 feet, 20 feet? We will be at our what? Where we were, right? Does that make sense? Doesn't make sense? When you are taken up from into the clouds, you will be your height. You follow what I'm saying? But we will all grow up to what? How we originally were, right? Does that make sense? And so even the herbs in the new earth are a part of God's plan. Now, there is a statement taken from the writings of Ellen G. White, which I was talking about when I started out. And this one is particularly interesting. It says, there are simple herbs and roots that every family may use for themselves and need not call a physician any sooner than they would call a lawyer. Now, I ask myself, how many times have I actually needed the services of a lawyer? And to my recollection, there is one time, there was this property that my brothers and I were, wanted to purchase, and that was it. So in all of my 62 years, I've used the services of a lawyer once. How many times have I gone to a physician? I got in an accident twice. One on a bike, and I broke my leg, so I had to get a cast. Another one, I was playing up around Rangers Club, and I fell, and I got this cut. And so I got that up, right? Honestly, if doctors had to depend on me, they'll be all poor. But the point is, if we do the things that we should do, right, our bodies will keep us, and we will not necessarily need all the services of a physician, all right? Because we are following what? Following the principles of health, the laws that govern health, and God has promised us. If we follow these, He will what? He is our true healer. All right, let's move on. Well, let's take a look. Many modern pharmaceutical medicines are based on what? Plant-derived what? Substances. So significant enough of them actually come from what? plants. Or they are isolated phytochemicals, which are plants from chemicals, or they are manufactured synthetically. So that's where most of our medications come from. But this is an important point. Side effects are almost always experienced. And why is as you read, the chief chemical components are what? Are missing. In addition to many secondary plant chemicals which support the what? Chief compound, buffer toxic side effects, or enhance the body's ability to properly use the herbs. So when we look at a plant, it has multiple components, and one of them is ginger, and it has over 400 phytochemicals. Can you imagine that? Is that complex or simple? That's complex in the context that we, even the greatest scientists, are not able to decipher how all of those interactions are taking place. But God created that. So we don't have to worry about the complex science. We just have to take it as God gave it. Does that make sense? All right? But what drugs are, they're taking out one chemical, right? And so all the others are missing. So the liability to create what we call side effects or toxic effects is much greater because it's only one what? One component, one thing taken out. And the question is, why would they take out one and not use the whole plant? Anybody got a thought as to why they would take out, not use the whole plant, but just use one chemical? The question is, you cannot patent a whole plant, right? But you can patent one constituent. So take out one so they can patent it and make money from it. But what it tends to do, it creates this imbalance that creates a lot of health issues that people have, okay? Because it's not the whole thing. So the best thing under most circumstances is go back to what? The whole plant, right? And so we're going to look at these extracts from that. All right, so there are different ways of herbal preparations, things that we utilize to help. And one is a bath. Now, basically, you have to soak for a minimum of 15 minutes so that the skin is hydrated so that it can absorb, right, the healing properties within the herbs. This is often used actually for people who don't like the taste of herbs or what have you. You can actually, you boil it up, or you do the preparation, you put it in the tub, and then you soak, right? All right? So in colds, fevers, flu, insomnia, muscular injury. So depending on the type of effect you need, you use a particular type of herb, right? And so if you're having problems sleeping, it could be lavender, right? That could be put infused in the bath, or other herbs like hops and passion flower or valerian. All of them have a calming, soothing effect. So people who have anxiety and all of that, these same herbs that help you sleep will also help you what? Relax and calm down, right? So bath is one way of doing it, right? It's a safe way of doing it. Boil up this. Put it in and then just relax, right? And while you're there in the bath, cast all your cares upon Him. See what? Careth for you. Trust in the Lord with all thine heart. Lean not unto thine own understanding. In all thy ways acknowledge Him. He shall what? Direct your path. So you use all the natural remedies, right? Put it in the water. Turn on the nice music, right? And music has a calming and relaxing effect. Plus the herbs in there, plus your confidence and trust in God. All of these things going together to bring about healing nature's way. Okay, body rubs. Ever had a massage? Rub, when we come close in contact with the skin, it creates amazing healing properties. They can be beneficial for bronchial back, muscle pain, colic, stomachy issues, constipation. So we use the aromatic herbs, and the aromatic herbs, gives you that nice fragrance, right? The smell, basil, rosemary, lavender, and thyme. All of those are good ones to help in rubs. All right. So you have your oil, and then you make what we call an herbal oil, and we're going to talk about what that is and how to make that. Very simple things that you can take the herbs, you know, and utilize it. So first you put it in a bath. That's one way. You can use that for kids, infants, adults, you know, everybody, right? Gets bath. You don't like the taste of the herb, plunge in the tub and have a good, you know, and make sure the water's nice and warm, right? You know, that helps to open up the pores, right? So the medicinal qualities can go into your skin, into your bloodstream, and bring about that wonderful healing. All right, so you have herbal oils and creams and ointments and salves. So there are different types of preparations that you can have. If you go to your regular pharmacy, you're going to see all types of, you know, preparations, right? If you read the ingredients, most of them you're not going to see anything related to what? An herb or a plant, right? You're going to see petroleum-based products like Vaseline, right? And Vaseline, of course, is going to stop you from drying because it's this oil paste-based, you know, it's going to block your pores, right? But we want things that actually nourish your skin, right? And so the best things are where we came from, right? We were made from the what? Dust of the ground. And the plants grow in the what? Dust of the ground. So it makes sense, right? That the things that grow in the ground where we came from, right? God has designed them to keep us healthy and, you know, bring back health if we lose this health. All right, so skin rashes, cuts, wounds, burns, boils, sprains, and many other health conditions. Athlete's foot fungus. Anybody experience that? Nobody want to say anything. I did up this preparation that worked very well. You know, we infused the medicinal herbs, essential oils, and took it away, no problem. You know, so God's ways are amazing. Back to the plants. All right, absorbing the medicines directly through the skin, and that's an example of a salve. You see that picture there? Nice colored, you know, and it can be very fragrant. Now, there are two things. One is a basic salve, and the other is what we call a balm, right? And the Bible says, there is a balm in Gilead. Now, that's a song that heals the sin-sick soul. And what a balm is highly aromatic. A balm has more of the fragrant component than a regular salve where you don't smell it. The minute you open a balm, it fills the room, right? And the perfumed, you know, alabaster. You follow what I'm saying? All of these rich, potent, healing properties that God has put in the plants for us to benefit from. Okay, capsules and tablets. They are used, a lot of things. Many herbs don't taste too well at all, right? And so if you can put it in a capsule, in a tablet form, you can take it in and you don't have to taste it, right? Some are actually concentrated in certain phytochemicals, or they ensure that that particular property is in the supplement that you get. Sometimes you can get things from the, you know, from the health food store, and actually you got unscrupulous dealers, and we looked at the ingredients, and some of what they say is there is not even there. It's next to zero, but they're on the label. It's got this and the other, and once it's analyzed, you don't see anything. All right. What happened to my picture? All right, are we back? Okay, let's take a look at the slide. All right. Okay, let's see if we can get the talking to one another. All right. Okay, fermentation and poultice. If you see that picture, it looks like something squashed up on this lady's arm. It's actually a poultice. And a poultice, you take this vegetable matter, right, and grind it or chop it up, and then you can apply it and then you can put a gauze over it and you can wrap it. And so basically what it's doing, it's absorbing the toxins or helping by bringing it through the skin. It can also stimulate the immune system, draw toxins, control pain, skin rashes, and swellings. Fermentations are more, it's an application of a moist, hot. And so instead of just water, you put the herbs into the water. So now you got the effect of what? The heat and the moisture that's in the fermentation, but you also got the effect of the infused oil, herbal preparation that's in there. So you're getting a double thing. You're getting the herbs effect, plus you're getting the water effect. So I haven't done that a lot in terms of when I was at UT Pines many years ago, but it's a good thing to add that to the whole package, so that instead of just the hot water, you have the infused herbs that help with the particular condition, whether it's pain or something else. All right, so that is something we can do. So skin rashes, pain, etc. Infusion. Now, an infusion is what we do with like leaves and flowers. And what happens is you have a cup of boiling water, you add a teaspoon of the dried herb, and you cover it and you turn it off and let it steep. 3 to 5 minutes. If you want to get more of the medicinal qualities, you can go anywhere up to 10 to 15 minutes. All right? You strain and you serve. A decoction is for roots and harder, roots and barks and things like that. And so you boil them for 10 to 15 minutes. So if you want to get the medicinal qualities out of your roots and barks, things like that, you want to boil them. All right? So those are two methods that anybody can right? Can do. Then powders, and you can take the dried leaves and flowers. In fact, you can pick it and you can dry it. Leave it in an area where it dries a few days. It comes nice and crisp. Then you blend it up in a blender, and now your own powder that can be used for what? Diaper rash, fungated, infections. If you got something in your feet, you know what I mean? Add it to your socks or what have you. It all depends on what effect you want. That depends on what decides what herb to use. Okay? All right. Then you have steam, right? Steam tent, where it's covered over your head, and in the water you have the herbal mixture. Warms, decongests the mucous membranes, the nose, sinus, and throat. So you use your aromatic herbs, some of what we talked about already. Put a few drops in there, and you just breathe in. The vapors can be very refreshing. All right? Suppositories and enemas put into your vaginal health or anal issues like hemorrhoids or fissures. The preparation is actually made where it's beeswax could be one of the things that are used, and beeswax is not very hard. And so you mix a proportion of beeswax, which is melted, in a carrier in a double boiler, right? And the beeswax melts, and then you pour it into a mold, and then it hardens, right? And now you have this hardened stick, and then you apply that hardened stick. It dissolves, and the medicinal qualities go into that area. Okay, so hemorrhoids and all of those sorts of things. So this is, amazing. These are a number of ways that we can use natural herbal preparations. Okay, syrups are to make things taste nice. And kids are one of the, the herbs can be really not taste too good, yeah? And so when you add it to a syrup or something like that, it tastes better. You know, and some things that may taste horrible. For example, ginger tastes nice in the right combination with some sweetener. But you try to take fresh ginger juice, right? And you consume that. I'm telling you, you will stop dead in your tracks, right? It's just too potent, right? It'll burn you, right? So it's all about getting that right balance, and syrups are one way of doing that so that it can taste nice and be healthy for you. One of the preparations is, what is it called? It's a elderberry syrup. They sell it in the pharmacy and even a health food store. It's good for influenza, colds, and things like that. It's a syrup made from the elderberry. It's dried, it's boiled, right? Because the elderberry dried is hard, right? And it's boiled for example, let's say a half a cup of berries to about a cup of water, 2 cups of water, and then it's boiled to half the water is going away, right? Now you got this concentrate, you add your sweetener to it, and you bottle it, and you have your syrup, okay? That's just an example. Tinctures are ones that use alcohol. I don't prescribe to using alcohol, but that's a method, and you will see some that have alcohol in them. There are others where alcohol is used to absorb, to get the medicinal qualities out, and then they get rid of the alcohol, all right? And so it's non-alcoholic extract, okay? But that's what a tincture is. Tinctures taste horrible, right? Right? It's very strong and tastes horrible. Now, this is a dosage formula. When you're looking at children, most times you see the dosage in in adults. So the age in years divided by the age plus 12. That's basically it. So a 6-year-old, 6 divided by 6 plus 12 is 6 over 18 is 1/3 of the adult dosage. Okay, so that's a simple formula that can be useful to adjust the proportion. All right. For chronic long-term conditions, 3 times a day, usually with meals for 3 months. Okay? 3 times a day for 3 months. Acute condition such as fever or flu, 5 times a day or every 2 hours. Now, this is important because most people haven't a clue. They say, well, let me try this herb. I got this problem, but they don't have no sense of how much to what? To chew. And then they take far less than what is needed, and they conclude that what? It does not work. It's not that it does not work. It's you're not using enough. All right? You need to know how much to use. And so if it's acute, something comes on, you want a much higher dosage every 2 hours or 5 times, something like that. And it's the same way even with hydrotherapy, which we're going to talk about at another time. You know, several times, this is an acute condition, it's come on, and in some cases, they will work with people for like several hours, right? You follow what I'm saying? To get them through that crisis. But you have to know what you're doing. So that is what we're looking at. Now you got essential oils. And essential oils, if there's anything that's pretty concentrated, similar to like a drug, essential oils. And so you need to be careful with essential oils. Don't take them internally, right? There are some preparations where it's a small percentage of it, and it's within that preparation. But as a rule, do not ingest them, right? And one of your questions said they should be diluted. There are a couple of exceptions to that. But tea tree oil, that can be applied full strain, and lavender essential oil doesn't have, but some of the others, you apply it directly, it's gonna burn. It's just too potent, right? But those two tend to be, and lavender is an amazing, right? Helps and we'll talk a little bit about that as we go along. Okay, stimulate the olfactory nerve, right? Going up through here, carry impulses to the brain, especially the limbic centers that govern emotional state. So emotional state, there was a study where they took these stressed out people and they took them to the forest for 2 15-minute periods, and their stress levels just came right down. They sent them to a pine forest, all right? And we know that pine, fir, and cedar, actually from the pen of inspiration, the spirit of prophecy, my health guru, where I got my start from, she stated that the fragrance from the fir and the cedar and the pine and others have healing properties. And how does she know that? And nobody at that time had any clue. You know, you breathe in the fragrance that it's going to actually have healing properties. So getting out in a forest, getting out where there are lots of trees. In fact, where I went to school, one of the schools, Yuchi Pines. And pines is what? Pine, right? Pine trees all over the place, acres of it, right? So it was in the right place, you know, for the pine. And you wake up in the morning, right? And you go out and breathe, walking through there. No wonder the people get better, right? They start sleeping better, feeling better. All because of nature. All right. Take a tub bath, right? You can add how much? 6 to 12 drops of essential oils to a tub full. So if you're using essential oils, 6 to 12, put it in a tub, and that should be fine. Mix it around to evenly disperse it. A cup, okay, 4 to 15 drops of essential oil to 4 cups of water, right? Mix that around, then you have your cloth, right? And you dip it in, you wring it, you put it in, you take it out, and then you apply it to the area. You follow me? And it could be with congestion, it could be pain, it could be any number of things, right? So you heat it up, wring it out, you got the essential oils mixed in there, and then apply it. And when it starts to cool down, you could have another one in the hot water if the water needs to be a little hot. You follow what I'm saying? Now, if it's boiling hot, you're not going to wring that out and apply that to anybody's skin, right? So what do? You take a layer of a dry towel and put it on first. Then you put that over it. You ask them, how is this feeling? Is it too hot for you? If it is, you put a second layer under it. You with me? And you could put something like a blanket on top of it to try to hold the heat in, right? Like army-type blankets, which is a combination of wool and cotton, help to hold the heat in. And then when that cools down, you apply another one, and you have the medicinal herb in addition to the water, right? And the moist heat and all of that helping with whatever condition people are dealing with. All right, warm or hot for arthritis, cramps, and muscle pain. An example is rosemary, okay? For cold, for tension, bruises, and headaches, and you can use lavender. So there are some conditions that work best for what? Cool, and some work best for what? Hot, all right? So it's important. Sometimes you may try hot, and hot doesn't work, or you try cool, then do the opposite, right? And based on their response. So compress is something you can use. Chest rub for cough and congestion, 20 drops. You've got eucalyptus and thyme and basil to a 1/4 cup of almond or olive oil to create a salve. And a salve is a solid, okay, where you can go like that, and you can rub it on, you can put it in, crack lips, crack, hands and all of that. You go, what's that, Vaseline intensive care? Man, that has nothing on natural preparations. And you'll see. Okay, so essential oils first added to the mixed container, okay? So next, the melted beeswax. You can use what is called a double boiler. You have one pot, put it in another pot. The first pot, you put water in it, right? The second pot floats in what? The first pot, right? And you put the oil and the beeswax in there, right? You put a top on, and then you boil that, right? And then what happens, the beeswax, what? It melts, and it's dispersed through the whole of the what? Okay, now you have a storage container, a little bottle or something there, and you put the drops of the what? Essential oil in the bottle. Then you pour in what? The mixture, put a top on it, and just mix it over so that, and then you just let that solidify. Many cases it's solidified within a couple of hours. And now you have your own, little salve, and then you just take up and you rub that on there, right? So that's a very, good healing combination, all right? So that salve could be anything. It could be for memory, it could be for pain, it could be for insomnia. You switch the herb based on what? The effect you need, okay? And even immunity, because if you rub certain herbal preparations in your feet, right, in the bottom of your feet, it will get expressed in your lungs, the aromatics, and in a few minutes, it's so the aromatic qualities is going from there to your chest. So you got a chest congestion. Yes, you can have it applied to the chest. You can also apply it to the feet. Feet just absorbs everything, right? You go right in, and it comes out through the pores, and this is the amazing thing that God has done, in the plants. I mean, we came from the earth, and what grows in the earth keeps us. All right, so finally mix the two, pour into the storage container, cover, and label. All right, so that's that. Massage oil, therapeutic, 8 to 12 drops of essential oil to about 2 tablespoons of massage oil, so 1 ounce to 2 tablespoons. For general, 15 to 20 drops for intensive action. Okay, if it's really intense, then you want more of the essential oil. Okay, now 90% of what I'm sharing here is in your handouts for those of you who have your handouts. For those of you who don't have handouts, if you're on the program, you should be getting it sent to you. All right? So that's that. So let's talk a little bit about some specifics. And honey is amazing. It's more amazing than I thought some years ago when I went into the research and took a look at it. And let's talk a little bit about it. Number 1, my son, eat thou honey because it is what? Good. And the honeycomb, which is sweet to taste. It is what? It is good. Okay, number 1. Number 2, hast thou found honey? Eat so much as is sufficient for thee, lest thou be filled therewith and vomited. So there is balance, right? You have enough, it's great. You have too much, it will be detrimental. Okay, so there are benefits. Now, when we look at herbal medicine, we look at what we call a monograph, and a monograph summarizes all the pieces. First of all, it tells you what part is used. It tells you what are its actions. When we talk about action, we talk about what we call the therapeutic effects of a particular thing. Okay? So, honey, it's the full strength or diluted. So that's how it's used. Okay? Are you with me? Okay, it's antibiotic against all forms of resistant bacteria. And what is a resistant bacteria? Resistant bacteria is a bacteria that all the antibiotics we give don't work. They don't work. They used to work many years ago, but they don't work now. And why is it they don't work? Because these one of the reasons given is because of the animal husbandry industry. In factory farming, they use about 80% of all the bacteria, antibiotics. And when antibiotics are used over and over again, these bacteria actually learn how to get around and survive. And they develop resistance. They are like smartphones. And in one study, they develop resistance to a particular, what can I say? They develop resistance to something that wasn't even known at the time. They are amazing. So the less antibiotics you can use, the better off you'll be, right? Do not indiscriminately take it in. make sure it's a reason for it, right? Sometimes it's given for something that it can't even address, you know? So it's anyway, so I don't want to spend much time. So it's antibiotic. It stimulates the immune system. It's an expectorant, so like you're coughing, you know, and so it helps with lung type thing. It's antiviral, anti-anemia, increases your hemoglobin levels, antifungal, anti-inflammatory, inflammation, and it can have a tonic-like effect. So let's look at indications. These are tons of things. I'm not going to read it all. So cuts, legs, skin ulcers, gangrene, diabetic foot ulcers, post-surgical wound infections, abscesses, radiation burns, gingivitis, that's gum, dental plaque, helicobacteria, infection of the stomach and duodenum, all positively impacted by using honey. All right. Prophylactically, to prevent something before, a catheter is that picture there. It's a device that's inserted into the body, and they will put a little honey on it, and that will actually prevent the bacteria, you know, because sometimes, anytime we're inserting things, the potential for what? Bacteria and infection. And one of the places where higher levels of infection are in the hospital itself, right? So utilizing honey can actually prevent infection. Amazing us coating the honey. Wound healing, surgical wounds, burns in hospitals. It's reliably effective against resistant bacteria. 30+ clinical studies have looked at the effects of honey and positively shown its impact on bacteria. Pharmaceuticals, honey, Medi-honey. It was used in the UK, another one in the Netherlands. Bermuda Hospital Board is using Medi-honey. This is Medi-honey, right? Right? It's expensive, but it really is not. All it is this, what's that honey, Manuka honey? Anybody familiar with Manuka honey? Yes? Yes? It's you know, any wild raw honey will work. Manuka is just a pretty potent one. But once they label it Medi honey, the price goes through the roof. All right? But, okay, this is Bermuda, right? Any wild honey is acceptable. The more types of different flowers to make up, the more potent. So what's happening? The bees is getting, healing properties from what? All types of flowers, right? And it's bringing it all together. So you had the impact of flowers all around Bermuda, right? When you use Bermuda honey, right? For burns, first, second, and third degree burns, directly apply full strength, covered by sterile bandage, changed once or twice daily. So that's where it works. First degree, it's very superficial. Third degree, all the way through, right? Okay, this is a little honey. You apply the honey, put a gauze on it, wrap it, 1 to twice a day. That's basically it for all of these health issues, right? Is it going to create any health problems for you? Nah. If anything, right, no benefit. Chances are likely, right, if there's some type of infection or cut or anything, the honey will what? Would heal it. The best type of honey is your wild honey, right? Your raw honey, right? Honey's at the health food store rather than your honey you get at the regular grocery store, the clover honey. You know, it looks so clear, crystal clear, you could see through it. That's not what you want. Okay, ulcerated bed sores, even to the bone, right? Same as for burns, right? Infected or non-infected wounds, same as for burns. In pentigo, this is a bacterial skin infection. You see that. This is a chin. Bacteria dilute using what? A wash to apply. And dermatitis, seborrheic dermatitis, same as for impetigo. Okay, internal use as preventative, 1 tablespoon undiluted, 3 times a day. So you can actually add honey to what? Other herbal preparations, right? So you got the benefit of the honey plus the others, plus it makes it taste what? Taste better, right? Okay. Acute conditions, 1 tablespoon every hour, 1 tablespoon 6 to 10 times a day. This is a cold or flu tea, 4 tablespoons of ginger juice. And when we talk about ginger juice, if you have a juicer, right, you put the fresh ginger in the juicer and you get the juice out. And that's what it's talking about. It's concentrated ginger juice, all right? So it's 4 tablespoons of the juice of 1 lime, an 1/8 teaspoon or less of cayenne pepper. If you don't like that real burning, leave it again, but it's a circulatory stimulant. It'll work fine even if you didn't have that in there. 2 cups of hot water, right? Okay, so you mix that together, and that's the combination. So the idea is 4 to 6 cups a day. Now, that recipe makes how much? Just about 4 cups, right? So let's say you make a double, right? And throughout the day, you're what? Drinking this, okay? So this whole concept of if it's an acute something, you want to do it like every 2 hours. You follow what I'm saying? So you make up this preparation nice and warm, keep it warm, and throughout the day, you're sipping it, you're taking it in, okay? The fresh, okay, let's not go there. All right, that's good. If you don't have a juicer, you can finely grate it, right? And steep it 2 to 3 cups of boiling water, turn it off, cover it for 3 hours. Or you can blend it, right? Blend it all up, right? Do the same thing, cover for 3 hours. If it's stronger, add more water if it's too strong, okay? Honey as indicated in the drum. So that's a simple recipe. So fake versus genuine. Less potent single honey, unless a few examples, Manuka honey. It's a single flower, but it's a potent flower. But under most cases, the more flowers the bees interact with, the greater the potential for your overall health. All right? Up to 75% of store-bought honey in the U.S. cannot be considered genuine. All right? Many remove all the pollen, and sometimes they adulterate it with corn syrup. So sometimes it's not even totally honey, right? So people do stuff for the purpose of making money. It tends to be all honey tested from your health food stores were good, right? It always has a little pollen, maybe a little cloudy, a little burning in the throat. And those are ways of looking at honey that is, this is the real stuff, okay? All right. Pyromyositis, abscesses, 23 children. They gave them honey or this Usol soaked dressing. So what I'm going to share with you is comparison between honey versus what? Medicine, okay? And what are the outcomes? So that's what we're going to look at there. All right, so the honey, faster healing, length of time in hospital was shorter than with the medication. All right? Chronic complicated surgical or acute trauma wounds. Honey was easy to apply, kept the wounds clean, stopped infection, was very safe. And another 105 people were involved in another study. In the honey-treated group, it was 100 days. It was 140 days in those that did not have the honey. Leg ulcers, intrasite gel versus honey. Incidents of healing, deslopping. That means, removing, the dead skin cells and all of that there. Not dead cells, rather. Lowered infection rates in the honey-treated group compared with intrasite gel. Okay. What about pressure ulcers? People who are, bedridden and others, they're not moving around, so there's no circulation, right? So what happens to the tissue? It dies, right? That's why we keep turning them, right? So that the circulation, because that pressure applied, right, is hindering circulation of blood and oxygen. So if that continues long enough, the tissue is going to die. Okay? So that's why you're turning them, that people who are bedridden and all of that. All right? So what happened? Pressure ulcers were treated with honey. And 15 and 11 with the medication. Honey group healed was approximately 4 times more effective than those that had the medication. All right? Pharmaceutical only 1 in 20 patients in the honey group developed intolerable oral mucositis. So it's inflammation related to radiation in the mouth. So those who had the honey group compared with the drug improved much better. 30 people infected with diabetic foot wounds were treated with honey for 3 months. 43% experienced complete healing, bacterial load, so significantly reduced after 7 days. All right, failure rate was only 6.7%. And this is good old honey that you can get at a health food store, right? Right? Limb-threatening diabetic infection, full sickness, skin ulcers, deep tissue infection, gangrenous lesions. 100% in group 1 healed, 92% in group 2, 100% in group 3. After surgical incision, debridement of necrotic dead tissue, treatment with the honey worked well. It included royal jelly, which is a honeybee secretion used to feed the larva as well as the adult queen bee. All right, but good old honey, very effective. Burns, 78 people with burns, less than 50% of the body. The honey dressing, which is the medication dressing, healing time, 18 days in the honey, 33 days in the silver medication. Honey group sterile in less than 7 days. The drug group, none became sterile. Labial herpes in the lips, duration of attack, decrease, degree of pain, crusting, healing time. You can see it compared with the medication. 35, 39, 28, 40% better than with the drug treatment. Same case with genital herpes. Just applying good old what? Honey. All right. What about dermatitis, seborrhea dermatitis, and dandruff? All right, you can buy the dandruff shampoo, or you can try this here, right? So what did they do? Looked at scaling, itching, hair loss, topical raw honey, 90% honey, 10% water, right? So that's the mixture, okay? Treatment, every other day for 4 weeks, and left on for 3 hours. Okay, so, and then rinsing with warm water. All right, so that was the, the protocol. So every other day for 4 weeks, left on for 3 hours, then rinse. And what was the result? Honey group itching was relieved, scaling disappeared within 1 week. Hair loss was reduced. Within 2 weeks, the lesions healed and disappeared. None of the 15 relapsed at 6 months with 1 application a week prophylactically. So they did it for the entire treatment period. Then once a week, they did 1 treatment, and it never came back again. All right? Okay. Nighttime coughing due to upper respiratory infection. It was more effective than the drug in alleviating coughing. Other studies show the same effect. Good old honey. 58 boys were given 2 tablespoons of honey a day. Half were given 1 tablespoon in the morning and 1 in the evening. The other half got no honey. Both groups were similar in terms of diet, exercise, rest, age, and general health. After 1 year, what happened? There was an 8.5% increase in hemoglobin, right? This carries the oxygen, right? Oxygen carrying. Overall increase in vitality, energy, and general appearance. So the ones who had this honey were actually looked healthier in appearance and all of that than those that did not. Ulcerations to the bone, 3rd-degree burns, complete healing reported without the need for skin graft and with no infection or muscle loss. That sounds miraculous to me. The power of honey. Ulcerations to the bone. Outperforms antibiotics in treatments of stomach ulceration, gangrene, surgical wound infection, surgical incisions, and protection of skin grafts, corneas, blood vessels, and bones in storage and shipment. That is honey. Yeah? Honey was effective. This is 17,862 patients. This is a Bulgarian study. Honey was effective in improving chronic bronchitis, asthma, bronchitis, bronchoasthma, chronic and allergic rhinitis, and sinusitis. So this is all upper respiratory issues improved with good old honey. Department of Pediatric Oncology at Children's Hospital and University of Bonn regularly use honey in healing of wounds impaired by chemotherapy and has found it highly successful. 7 patients with MSA, this is infections resistant to bacteria, were treated with honey after antibiotics failed to eradicate the infections, and all were successfully treated. So even in issues where people have burns or infections, a very safe thing is honey. So in your kit, you need to have what? The real deal. It's an amazing something. Okay, we have a question or comment.
Not a question, it's just sharing something. Many years ago when I lived in the U.S., my medical doctor was from Cuba. He actually, when he was in Cuba, he was also part of the medic in the military in Cuba at the time. And he said one of their training exercises that he was on, they were deep into the jungles in Cuba, and one of their colleagues had gotten injured, and he did not have any antibiotics to give him at the time. So what they end up doing, they were able to secure and stop the bleeding because of the type of wound that the soldier had. And then they found some wild honey because there were bees on a tree nearby. He took the honey, poured it over the cut, bandaged it up. It took them several days before they can actually get back to their encampment. Once they got back to the encampment, the medical team, when they unwrapped the bandage, said to them, wow, it's a good thing he recently had this wound. And they said, no, he's had this wound for several days. And because of the honey and the enzymes, it preserved the wound, so he didn't have any gangrene or infections because of it. So that was the first time I actually heard about using honey on wounds, which was great because he proceeded to explain to me the effects of the enzymes in healing cuts and bruises.
Amen. Testimony. God is good, and I believe that He has made it simple for us to actually bring about amazing healings, you know. And the things of nature that are around us are very powerful. You know, you take a tree and you burn the wood, right, to get you warm, and then what's left over is maybe what we call charcoal, right? And you can grind that charcoal, right? You can add it to water, you can drink it, and it can absorb toxins, right? If you have gas, you have diarrhea, you follow what I'm saying? So this same tree, right, that produced fruit, right, and now you're taking the bark of it and you're using it to provide you with heat, and then that which is left over still heals you. At all stages, it's healing. Isn't that the type of God we serve? It's all there for us. I mean, it's just simply amazing. All right. Patient with chronic wound that did not close over 20 years. Can you believe that? Can you imagine 20 years a wound that never closes over? Well, despite all treatments, provided healing in 15 days using the dressing impregnated with honey. So you have the dressing and the honey is impregnated, infused into the dressing. So they just apply the dressing, right? Once or twice a day, and in 15 weeks, something that lasted for 20 years was healed. Amen. All right, that's honey. Okay, that's something that any of you could get, right? It could be used for multiple health issues, right? And there's no likelihood it can cause any issues. All right? Now, of course, if someone is diabetic and got poor blood sugars, you need to be careful about ingesting and all, but externally, man, it's good to go, right? All right. Okay, good old flaxseed. Flaxseed is another miraculous plant. I'm telling you, it's amazing. Let's go very quickly. The seed and the oil is mucilaginous, it's oily, right? It's bulk forming, so it gets your bowels moving. It's immunostimulant, anti-tumor properties. It helps for menstrual cycles in women. Demulcent, and has a soothing effect. Supports bone health, improves insulin sensitivity, so that's diabetes. Lowers lipoprotein, so that's your cholesterol. Antioxidant, it slows down the aging process. Anti-inflammatory, it's inflammation and pain and swelling and redness. This is anti-inflammatory. Inhibits platelet aggregation, that means the clotting of the blood. So the blood doesn't clot, so you end up with a what? With a stroke, right? Or heart attack or something else like that there. Improves mood disorders, ADHD, high blood pressure, kidney disease. Okay, let's take a look at a couple of them. Prostate cancer, 161 patients scheduled for removal of the prostate. They were a control group. They got 30 grams per day. That's about 3 tablespoons or something like that. Flaxseed supplement, low-fat diet, 30 days. Tumor was assessed for growth and death in prostate cancer. The growth was significantly lower among men assigned to the flaxseed arm. Okay? And you see the course because it's there. So they were going to get their prostate removed anyway, but in 30 days, and they looked and they saw the actual decrease as a result of flaxseed. Benign prostate hyperplasia. If you look in the picture there, you see the prostate size increases, and it obstructs the flow of urine, right? So you end up with, decreased flow, spotty flow, getting up hours and hours in time because this prostate is pressing against and it's preventing the flow. So they gave them flaxseed extract, high in this phytoestrogen, and they looked at the lower urinary tract symptoms, and that's what LUST stands for. 87 individual with increased prostate growth over 4 months. So you look at poor stream, hesitant, straining when passing urine, increased frequency, urgency to pass, incontinence, need to get up to pass urine at night, etc., etc. And what was the result? 0, 300, or 600 milligrams, and everything improved. Went from moderate, severe to mild just by consuming this flax. Comparable to the drugs, so it was comparable to the drugs for the same treatment of benign prostate hyperplasia. So good old flaxseed, right? That could be added to a smoothie, could be added to cereal. You want to make sure it's ground up fine, because if it's not ground, it's going to what? Pass right through you. Okay, you only may get benefit of the outside coat, which gives it that sliminess. Back in the day in Bermuda, I think they used to put it in water, and it's thick, and the thickness is actually the outer shiny coat. Okay, but a lot of the healing properties are inside the seed, and you're not going to get them if it's not ground. It will just pass right through. Yes?
Hi, Lee. The flaxseed meal, is that just as good?
That is the same thing. Probably a good thing, though, if you can do it freshly ground, that would be better. Because once you ground something, it gets exposure to the air and the oxygen, so it can start that process of breakdown. Okay, so best to buy the whole seed. Maybe blend up a half a cup of it. Put it in a container in the fridge, and use out of that. When that's gone, blend up some more. All right, and that should be it doesn't matter which color you get; they're both the same. Okay, you have the dark brown and then the light, and they're both the same in terms of health-wise. Breast cancer, newly diagnosed breast cancer in women, 25 grams or 3 tablespoons in muffins. So they were added to muffins. So one thing you can do is you get some muffins and make sure you add some what? Some flax seeds to the muffins, because all of these benefits are there, right? So this is what happened after 32, flax 39, placebo days. Tumor tissue was analyzed for rate of growth and death of tumor cells. Two cancer growth factors decreased, you see 34%, 71%, and death rate of cancer cells increased by what? 31%, right? And a review of 10 studies reports significant decrease in breast cancer, growth of breast cancer cells, and mortality in breast cancer survivors. So even individuals who had breast cancer, those who survived, better outcomes were those who consumed flaxseed. So it helps from prevention to treatment all the way through. So flaxseed is definitely your friend. It has these lignans which are formed in the gut, and what they do, they bind to the estrogen's receptor. The estrogen is the problem, right? It blocks the receptors' hormone activation. So estrogen promotes growth, right? Growth of good cells, and it can promote growth of what? Bad cells. You follow me? And so it blocks it. And it not only blocks it, it promotes the excretion of excess estrogen. So these are two factors that are associated with it in terms of growth factors. Hypertension, 30 grams, about 4 tablespoons, 6 months, 2 to 50-fold increase of these lignans, omega-3s. So when we look at the blood pressure decrease, let's look at those who had blood pressures greater than 140, decreased 15 millimeters of mercury, systolic, and 7 diastolic. So it was comparable to some of the drugs that are utilized for lowering blood pressure. So, so you got good old flaxseed. That's about 4 tablespoons of flaxseed a day. Most of us don't consume anywhere near that one. Those of us who do it, maybe a spoonful. But if you're looking for some therapeutic effects, you've got some real issues, then you're going to have to up the amount of flaxseed. One study I talked about some weeks ago with regard to lupus, they used over half a cup a day of flaxseed. That's a ton. They had this huge thing of smoothie, and they were just consuming this, you know. And it was 3/4 of a blender with greens packed, and 1/4 with berries and other fruit, and a half a cup of flaxseed. And these are people who have real critical situations, and they consume that for like 3 to 6 weeks in a row. You follow what I'm saying? And reverse, you know, a number of really serious health problems. So, all right, but you need to know what you're doing, right? They consume a minimum of 8 cups of water a day. No, a gallon. Yeah. The more flaxseed you consume, the more fluid you have to consume with it, right? It can bind you up, all right? So you want to make sure you have plenty of fluid if you're consuming more flaxseed. All right, so it lowers blood pressure, cardiovascular risk factor, flaxseed bars were used in this example. You see the cholesterol dropping, 12 points, the bad cholesterol, 15, and the oxidized, which is the really bad form, is 25% decrease. All right, so what about fatty liver disease? Now, why has the liver got all this fat in it? Well, it's the same reason there's fat in the heart and fat everywhere else, right? Excess, the body tries to get rid of it and just deposits it everywhere because your body normally makes all the cholesterol it needs. So when you add all this extra, then the body says, how do I get rid of it? Well, if you're on a no-fiber diet, right, you're in bad shape. You follow what I'm saying? Because fiber actually binds up this cholesterol and takes it out of the body. So if you don't have fiber and you're eating foods that are high in saturated fat and cholesterol, your numbers are going to potentially go through the roof. And then it's going to deposit everywhere. The body's depositing in your liver, you name it. Everywhere gets its supply because the body's just trying to save you. All right, so 12 weeks. Weight, liver enzymes, insulin resistance, buildup of tissues, fat, and the take-home message, everything improved. including the liver enzymes. The liver enzymes gives you an idea of how your liver is functioning, right? And the numbers are elevated, something's wrong, right? All of them improved by consuming approximately 30 grams of flaxseed a day. All right, so that's amazing things happen as a result of that. Carpal tunnel syndrome, right? You've got a nerve here, the median nerve, right? And there's this issues associated with that. So it's tingling, numbness, weakness, and pain. So conservative treatment cannot reduce symptom severity successively. So what they did is they got the linseed oil. In Iranian traditional medicine, it's actually used for pain, anti-inflammatory, antioxidant effects. And so 100 patients with mild to moderate carpal tunnel syndrome were divided in 2 groups, 4 weeks with topical placebo and linseed oil. In addition, they both got a night splint. Okay, and what happened? This is the Boston Carpal Tunnel questionnaire, and they tested the median nerve, okay? And both improved, significant improvement in the score, functional status, and the speed at which electricity was conducted through the median lower nerve was better than those who had the placebo. So it increased nerve conductivity, and it helped with all the symptoms associated with carpal tunnel syndrome. All right, and that's just rubbing the flax oil in that area. What would I add in addition to that? I would take it what? Internally, right? Take the whole flaxseed internally, rub the oil externally in that area, right? That may get some immediate effect right there, and then the internal is going to heal you from the inside, all right? And that's that. Oh, attention deficit hyperactive disorder. How many kids are being given Ritalin and all sorts of stuff? There was a mother who came to me many years ago, and her son, they wanted to put her son on, medication. He was a young guy. And she determined that she would what? I'm not doing that. So, Dr. Gibbons, what can you do? What can you do? So I shared with her, do this. And she's been singing those praises ever since then. He's fine, he's perfectly fine, never had, no issues, and he's doing very well right now. And every time she sees me, she says, thank you, And I think sometimes they invent things. I may sound really kind of, cynical, but the truth be told, the drug companies are they're a double-edged sword, and sometimes they do things. And I believe sometimes we've created diseases for the purpose of giving people medication. I could give you research on that, so I'm not just talking off the top of my head. But it just comes to mind. You look around you and you see, well, 100 years ago, this wasn't so, right? How could it be that there are so many people today when it didn't exist? And anyway, we're not going to go down there. Let's move on. Right. Okay, so what's the problem? Lots of clinical experiment evidence support the idea that deficiencies or imbalances in what? Highly unsaturated fatty acids that are in the flaxseed, right? Contribute to common developmental disorders. So these deficiencies in these fats are related to a number of what? Developmental or disorders. In your brain, it has a higher level of these what? These fats. And these fats come from plants, right? So you have the wrong fat composition of the mother, right? And then the kids fat that same thing, then what do you have? Deficiencies. So you end up with all these issues, you've got all these problems, they're coming up, and the drug companies are looking for some new way of what? New way of addressing this, that, and the other, when we need to step back and ask ourselves the question, what's missing? What is this trying to tell us? What are the essential fatty acids? Where do they come from, right? And how can I make sure that I have enough to see if that actually does what? Reverses the situation, right? Because disease is an effort of nature to free the system from conditions resulting from a violation of the laws of health. What laws are violated? What is nature trying to get my attention regarding, right? What's the fire alarm? You know, I'm agitated all the time, you know, I don't sit still. So what's really going on here, rather than labeling them with ADHD and giving them some pills? You follow me? So let's step back. What's the diet? What's the diet like at home? You know? I believe a lot of kids who are, you know, high-strung and hyperactive and all of that is the diet, right? It's the diet, it's the music, right? It's what they're seeing. You follow what I'm saying? And they're constantly stimulated by this unnatural world in a building environment, and we're designed to be where? In the what? In nature, right? That's where healing takes place, in nature. I mean, if you took half of them and just plumped them in a place where it was all nature, you know, with plants and all of that, and you put them on a whole plant food diet, in a couple of days, they'll all calm right down. They will. Yeah. So, there's a pilot study. They used flaxseed and they added vitamin C to it, oil. There was a significant improvement in ADHD symptoms reflected in reduced hyperactivity scores in these kids. But I would definitely go for the internal, right? Because you get all the benefits, not just the oil, the lignans, and everything else that's in the flaxseed. So go inside and make a amazing smoothie, right? You know, like a quarter cup of flaxseed, right? And a blender full with greens and berries. You follow what I'm saying? And flaxseed, I mean, 9 times out of 10, issues would just evaporate, right? If we just give the body what it really needs. Hot flashes. Okay. All right. I don't know what they are. I haven't experienced it. That's what I'm saying. I'm sure you guys could testify to that. But so it's this hotting, you know, sweat, you know, all of this here, right? So 6-week study, flaxseed, hot flashes, 30 women, not wishing to receive estrogen therapy. So they didn't want estrogen therapy. Decrease 57%, reduction in flight frequency 50%, from 7.3 to 3.6. Of course, there are other things one can do to help with this whole situation. But ongoing having, you know, flaxseed as a regular part of the diet, then can have some tremendous benefit. Don't have any major issues. I wouldn't go at like a 1/3 cup. You know what I mean? You know, if everything seems fine, you know, a tablespoon. You know what I mean? You notice things start, you know, up it. You follow me? And other things, okay? All right, so flaxseed is well tolerated with sufficient water, right? Consume 4 to 8 cups of liquid for every tablespoon of whole flaxseed, okay? That's for safety. Oral flaxseed can significantly increase the number of bowel movements and risk of diarrhea, okay? Some people may have a little more. So, you know, cut back a little bit. You've got a really serious problem, you know, face it. All right, spat it out every other day, right? And see how your body responds, okay? All right. Occasionally, allergic and anaphylactic reactions have been reported after ingesting flaxseed and flaxseed oil. And some people, they just have sensitivities, right? It's not like, it's not high, not most people. You follow what I'm saying? But some people will be sensitive. So you take a tablespoon, see how that responds. Your body, yeah, I'm doing fine. My body's responding okay. You follow me? Up it a little, keep going along in that way. All right. Theoretically, anticoagulant, antiplatelets, because it has those qualities, and you're taking drugs that have antiplatelet, anticoagulating fat. That's only theoretical. We haven't seen any impact with that. Anti-diabetic drugs, absorption of oral drugs. I mean, you're on a high-fiber diet. It tends to adsorb things that are not good for us, and it may absorb some of the drugs. So if it's a high-fiber something you have it, take it away from medications if you really need to do that. 2 hours before or after, something like that, should be fine. All right? Partially defatted flaxseed, they take part of the oil away, and then they feed it to people. It can create certain issues, so eat the whole thing, okay? All right, these are just some preparations, but it's all in your handout, so you really have to spend a lot of time. Okay. Come on. Okay, so you can see that, right? Adults, children, and older children, all of it's there, so it makes it safe, so you can progress based on their age and all of that. All right, and these are 2 recipes. Flax for egg substitute, or a cup of water, quarter cup of flaxseed, with it. You know, and on it looks gooey like you blended up some eggs. You follow what I'm saying? And you use a quarter cup for every egg in the recipe. Okay? All right, now that's not for every type of recipe, but that binding quality, that moisture that you get from eggs, you can use flax to do that. And plus it's doing much more than that, right? You know, even if you're making certain I don't know, gingerbread, I think if they use eggs with, I don't know. But with that moistness, it will add that to it, okay? All right, so flax is good. Flax not sprinkled, that could be sprinkled on something, right? It's got flaxseed, meal, walnuts, it's got a little date sugar, and little salt. You can leave that out. It makes it taste nicely. It could be sprinkled on things. This particular recipe has over 8 grams of omega-3, near the recommended one for treating bipolar patients with bipolar disorders. So, you know, they're high and they're low, you know. So a good old high flaxseed may be helpful for people who have ADHD, bipolar disorder, depression. In one study, I did this whole class on depression, the way out. Dr. Neil Natalie, and he was talking about this patient who is having depression, and they changed their lifestyle, and part of it was flaxseed, you know, this flaxseed and walnut combinations. And she started to improve significantly. Her depression, gone. And then she went off, you know, the flaxseed and all of that, and then she noticed everything started to what? Come right back, all right? So then she went back on it. So we're talking about something that helps with psychological related issues, and so there's food. There's a place for food for all of these. And just imagine, you know, you're going door to door, right? Yeah, knocking on the door. Hi, how are you? You know. You can introduce yourself as I'm a lifestyle educator, you know. You know, you can. We'll talk about that. Actually, we will do an example where I will interview someone to show how we can integrate this whole thing, so that we're meeting them where they are, right? And then you're there with them, right? And then you give them some basic rules, simple stuff, and say, do this for a week, you know. We'll be back next week. Let us know, right? Now, I did that when I was at Oakwood many years ago. And when I came back the next week, they said, you know what, I did that, and man, I feel so much better. Thank you so much. Thank you so much. Now I've got a friend. In how many months? No, 1 week. 1 week, I've won somebody over. Trust me, because I shared something with them. And just imagine, they've been taking pills for years, right? They had no relief. You shared with them something real simple, right? Non-invasive, not going to cause any issues. They apply it. They feel 100%, 200, 500% better in 1 week. Now you've got a friend. A person who is open and know that you really what? Care. Okay? And then you can say, you know what? I am concerned about your health, your total health. You know what I mean? You know, and what makes someone healthy? There's the mental side, there's the physical side, there's the spirit, there's the whole person. And so we start where people are, right? And we build from there. It should naturally flow. It shouldn't be this abrupt turn of events from this is this and then is, no. Because of this caring and meeting them, and it just naturally grows. And before you know it, they experience health and life at its best in every area of their life. And that's the goal. Yes?
Dr. Gibbons, are you going to have this available to our people, to ourselves, some of the rubs and stuff like that? Are you trying to put some of this together at some stage or the other so people can actually have access to purchase this? Some of the rubs that you talked about earlier.
Being that you asked that question, I'm going to answer. In addition to what we're doing with this type of a series here, we're going to have another type of series, and this is an intervention group program. So if you have health issues and major issues or what have you that you've been battling with and you've been trying to do something, so we're going to have a group style program here, and we're going to make stuff, right? We're going to have stuff. And we're going to make stuff so that people can get or purchase. That's going to be part of what we do here. Just think of this facility. This is a church, but it's also a something that actually meets the community needs, right? And health-related things is what we're going to be looking at this year, and making it more like what I went away to school originally, lifestyle center at Yuchi Pines, where people will come and learn how to live, and practice the natural remedies and experience healing. So we will be making salves and creams and lip balms and medicinal smoothies and supplements and all sorts of things that people can benefit from. So if you are interested, you have some health issues, you would like to be a part of a group-style program, make that known in communicating with, I think Roseanne has all the contacts, so feed that to her. Initially, I'm interested in part of the group program. I'll talk more about that and at a later time. But that's one thing that we're going to be working on doing. And of course, one-on-one, you can contact me based on what I shared with you earlier. Okay? All right, let's move on. Ginger, okay. How was our time? We got about 26 minutes or thereabout? Okay, all right. Ginger. Ginger root contains over how many phytochemicals? 400. Aspirin is how many? 1. Are you with me? 400 working together, right? Balancing out one another. Okay. And because of that, this is what it can do. Anti-inflammatory, so inflammation, pain, it helps. Anti-nausea, okay, sickness in pregnancy or air, travel, seasickness, whatever. Antibacterial, antidiarrheal, antifungal, immune stimulant, hypotensive, carminative, helps calm things, circulatory stimulant, causes you to sweat, antispasmodic, digestive, is a synergist. What is synergist? A synergist is something that enhances other things so that they work what? They work even better, okay? It helps make things go where it's supposed to go. Opens up the door, opens up the area so other things can get there, okay? Good one to add to any other herbs, right? Because it helps the flow, helps the body get it, right? There are some things that we can take, and they actually make antibiotics and other things work better because they increase the body's ability to penetrate and bring about healing. All right. So digestive system, nausea, chemotherapy, morning sickness, travel sickness, indigestion, colic, abdominal bloating, osteoarthritis, rheumatoid arthritis, morning sickness, painful menstruation, heavy menstrual bleeding. All of them are improved by ginger. Just think of all the meds. Just looking at these systems here, right? Nervous systems, common migraine headaches, all benefited by a root, a simple root. Yeah? Amazing. Dyspepsia, right? Indigestion. This had ginger and artichoke. Functional dyspepsia. 4 weeks, 2 capsules a day, and 14 days only. The ginger group shows significant advantage for the nausea and the gastric fullness, pain and bloating. Artichoke leaf, safe, promising treatment. Amen? Real simple, right? Indigestion, good old ginger. Fennel's good for that too. You know, so migraines. This is interesting. 1/8 of a teaspoon of powdered what? Ginger. That's it. Mean headache severity decreased significantly. Similar to the drug, sumatriptan. Adverse effects of ginger was less than the drug. All right? Question? Yes?
That word sumatriptan caught me because I have been suffering from migraines for years, since like high school. And I've never used any type of drugs from the doctor or anything for it. Always just done whatever my mind led me to do, compresses or whatever the case may be. But about 4 months ago, 5 months ago, I finally went to the doctor to get, well, not finally, but I went to the doctor to get a physical. And so she was asking about different things, you know, whatever's going on in my life. So I mentioned to her about the migraines and how long I've been having them. And she gave me sumatriptan. That's what the tablets are called. That's what the name is. That's why it caught me so quickly. But I've been using them when the headaches come, not the full strength. This is how she prescribed it to me. She said, take one sumatriptan and 2 Aleve. Wait for maybe like about 2 hours, and if it's still any type of agitation going on, take another sumatriptan, but no Aleve. So I cut the dosage down in half for everything. So when the headache comes, I take a half of the sumatriptan and 1 Aleve. And that pretty much, I never really had to go to the second phase of doing it again. But you're saying the ginger powder versus the sumatriptan will work better. I'm going to let you know if that works.
Okay. All right. Sure. Give it a go. This was just 1/8 of a teaspoon, right? That's approximately a quarter teaspoon of freshly grated ginger. All right. All right. So, I mean, you can take it more frequently. It's not a problem. You know, if you took 1/8 teaspoon a day, it's not going to create any health issues for you. And that may be a way of keeping it totally at bay. All right? Okay. Compared to sumatriptan, ginger also possesses better side effect. 2 other studies support the positive benefits of ginger and migraine. So there's been about at least three positive studies that show it is effective. Chronic knee pain, osteoarthritis, ginger, 25 milligrams, 30 days, non-steroidal anti-inflammatory, knee arthritis, significant improvement in knee scores observed. So just for ginger, for knee pain. Chronic subjective pain, review meta-analysis on ginger and pain, 8 studies. Conclusions are the same. Good safety profile without renal or kidney risks associated with the drug approaches, and similarly effective. Painful menstruation, okay, ginger. And 2 drugs were compared for pain management, 150 women, dysmenorrhea, 250 milligram powder 4 times a day, 3 days from the start of the menstrual period. So 3 days from the start of the menstrual period, that's when they start taking it, right? This amount is equal to a teaspoon of freshly grated ginger, right? So a teaspoon of freshly grated ginger started, okay? And 4 times a day for 3 days from the start of the period. All right, and okay. So no significant difference between the groups. All of them receive satisfactory results. No side effects from the ginger. So it was comparable, okay? Heavy menstrual bleeding, the decrease of blood loss in ginger group, significantly more remarkable, right? Okay. Nausea due to chemotherapy, very effective. 3 capsules of ginger a day, twice daily for 6 days. 3 days before the first day of chemotherapy, so it was effective at controlling nausea. So a half a teaspoon ginger. Very good. Preparations of several ways. Decoction, we talked about that, right? 4 to 5 slices, half an inch, or half a teaspoon of dry root. Simmer for 10 minutes, strain, 1 to 2 tablespoons in a half a cup of water 3 times a day, okay? That's, you have that, travel sickness, 1 to 2 capsules before traveling, and that's needed. Ginger tablets, ginger juice, 5 carrots, half an inch of fresh juice. Just put it through a juicer, okay? Antiviral effects are only present in fresh ginger juice. So for viruses, the fresh ginger is what you want. Okay? A lot of the other problems, fried ginger powder will work. Believe it or not, just ginger. Safety issues, peptic ulcers, just caution, gallstones with warfarin in pregnancy, consume no more than 2 grams of dried ginger during pregnancy. All right? That's per day. Garlic. Nice, right? Makes things taste nice, right? Okay. It is used about antibacterial, lowers cholesterol, lowers blood pressure. It affects worms, antiemetic, antioxidant, antiplatelet, antifungal, prebiotic, feeds good bacteria. Your beans, oats, and beets act like a probiotic. Okay, so you've got pre and po. Isn't that amazing? In the plant kingdom. Respiratory infections, show your common cold, influenza, bronchitis, asthma, chronic bronchitis. So you take that and you also add to that what? Honey, right? Yeah, honey makes it taste better, right? You add some lemon juice to it, right? Are you with me? You blend it up and you create this nice cough syrup, right? What? All there? Okay. Digestive infections, worms, candida, peptic ulcers, viruses, and bacteria. Okay, take it on the inside. Good old garlic. Cardiovascular system prevents blood clotting, right? Atherosclerosis, hypertension, lowers cholesterol, triglycerides. Okay, garlic supplements, 12 weeks. Allicin containing garlic supplement. Fuel coils, 24 versus 65. Virally challenged, 366 days. For those that didn't have garlic, versus 111 total days together. Total amount. Okay, Allicin, this is sort of a compound in it that's a marker for its effectiveness. We do have one of those where I work. It's an Allicin-containing supplement. That's very good. Okay, this is just looking at in China. The most onion family, 49 to 70% less prostate cancer. And you can see scallions was more effective than garlic, which is more effective than onions. So scallions are good too. You know, everything in the family is good. All right? Blood pressure. So your platelets aggregation goes down, the thickness or viscosity of the blood goes down, and the breaking up of clot increases. Now, fibrinogen is a strong risk factor for actually a stronger risk factor than cholesterol in terms of risk of a heart attack. Okay, and this is just a very small study, right? This is 9 patients in 5 hours, right? They were given 2,400 milligrams of garlic at a 1.3% allicin. And the systolic blood pressure dropped 7 and diastolic dropped 16 points. That's in 5 hours. All right, so sometimes it works amazing. So 11 studies combined, and they showed an average blood pressure drop of 8.4 systolic and 7.3 diastolic. So there is some blood pressure lowering potential for garlic. 4 to 6 weeks, so between 600 and 900 milligrams, lowering blood pressure. Okay, the LDL, decreased risk of a second heart attack by 50% after 2 years, and 66% after 3 years. All right, this is dropping cholesterol in one study. One analysis, 7 point, and another non-significant. So not all studies show significance, but a higher percentage of them show that garlic works good for that. So there is a way to prepare it. You can freshly mince it and swallow it whole with water, a little juice for cough, bronchitis, pneumonia, pinworms, parasites. Okay. The active component is probably at its best at about 8 minutes. So you chop it up, let it sit for about 8 minutes, then consume it, and you get the full potential. Okay, so that's garlic. Of course, if you're chewing it, and not most of people are going to do that, but do it. You can do it in a way where you put it in a formula, and I think I'll give you a little. You have a recipe of how to do it, which it will taste nice.
How much garlic, how much milligram of garlic can you take per day?
How much milligram? Okay, we'll get to how much we take, just in the air. So it should be in your handout. Okay, fresh garlic juice, used on infected wounds as a gargle for throat infection or as a poultice for warts. Okay, so is a wart or something, you want to cover the good skin with oil, right? With like a oil or something, and then you put the juice from the garlic right on the wart, right? If you get it on your good skin, it's going to burn it, right? But what you want to do is you want to kill the wart, so you put it right there. So that's what it's saying. Topical, put on a little oil around the skin first to prevent burning or blistering of the skin. So you're putting it on the area that is what? The garlic juice is going where the wart is, not on the surrounding skin. Garlic honey. You can slice 6 cloves of garlic, add 4 ounces of honey, and let it stand for 7 to 10 days. And then the medicinal qualities of the garlic goes into the what? It goes into the honey. Now you had a honey garlic oil, which you could add to other herbs, right? And other combinations, right? To, for herbal tea or what have you. Now you got your garlic infused in the honey, and then you can add that to some other herbs, right? Depending on what you're wanting to address, and it could be wonderful. So your colds, your flus, your sore throat, your cough, your sinusitis, all of those things. Garlic oil, you chop it and you put it in oil and you let it steep, right? And now the medicinal qualities go in the oil. It can be used as warmed oil for the ear, ear-related infections and stuff like that. Chest, you can use it as a rub, okay? That's a salve. For every 2 cups of oil, 2 ounces of beeswax. You can melt that, and the garlic can be added as a salve. Okay, you can add 10 to 12 drops of essential oils to improve scent, penetration, and medicinal qualities. Okay? You have that all in your handout. This is the one that I have at where I work now at Bermuda Wellness and Outtrain. It's called Galatrin. So 1 One caplet is equivalent to 3 cloves of garlic. If you don't like the taste, you can take something like that there. Or, of course, you can do that. A dosage, okay? 4 grams, 1% allicin typically produces approximately 18,300 micrograms of allicin. 1 clove of raw garlic provides about 5,000 micrograms of allicin. So this is about a serving. So 1 clove of garlic is a good dosage, right? Discontinue 10 days before surgery, okay? Has a blood thinning effect, right? Just to be safe. And caution if aspirin or warfarin, blood thinning, may have additive effects in lowering cholesterol and blood pressure. Okay, time. Time and sage. I just added a couple. So it's thyme and what's the other one? Nettle, okay? Now, nettle grows wild in Bermuda, so I added a few that are here. So thyme is expectorant, so it helps with coughing up, right? Spasms, right? Antibacterial, antifungal, antioxidant, rubefacid, topically increases redness, increases circulation. Okay, that's sort of like what cayenne, right? Would do the same type of a thing. It's antimicrobial, kills microorganisms, so stops them from growing. Acute and chronic bronchitis, whooping cough, asthma. Catra is related to bringing out phlegm, or inflammation of the upper respiratory tract, gastrointestinal dyspepsia, indigestion, cold, flatulence, dysbiosis. This is the imbalance in your colon. Bacteria, that stuff that live inside of you, those cells that are more than your normal cells. We call it the good and the bad. It's a family. Your immune system, 80%, a significant amount of it is in your bowels, right? So it helps with all of that there. Topically, it could be for fungal and bacterial skin disorders, right? It could be added to bathe, to baths, cream, salves, or hair oils, right? All of those things. Let's see. Tea. 2 to 4 teaspoons, a cup of boiling water can be sweetened with honey. Okay, that's one way of doing that. And nettle. Stinging nettle. Astringent, right? It shrinks or constricts body tissues. Alterative, it restores normal health. Diuretic, galactagogue, it treats low milk supply, so if you have low milk supply, consume more nettle. It's antiseptic, and tonic, invigorates, restores, refresh, anti-inflammatory, septic again. Right, anemia. It's high in iron, it's high in calcium and a number of minerals. So actually, as a vegetable, cook it, right? Of course, raw it's going to, right? You cook it, then you're good to go, right? You steam it, it takes it away, okay? And so you use it in your like you would do greens, okay? So it's a good thing. Put it in a juicer and extract the juice, and that'll help boost your iron levels. May have a tonic effect, heal digestive tract after gastritis or diarrhea. Okay. May help balance blood pressure, blood sugar, kidney and bladder, and seasonal allergies. So people who have allergies, that might be helpful. Yes.
Just a FYI, pregnant women should not use sting and nettle tea, especially in early stages of pregnancy, and I'm speaking from experience. When I was pregnant with my second child, having some issues, I actually took a tea of sting and nettle, and my son was born 1 month early because the sting and nettle tea actually causes muscular contractions. So it sent me into early labor. So it's advised that pregnant women do not usually drink sting and nettle tea. Now, I'm not sure about you chopping it up and using it as a green, but I can tell you for tea formula, it's not
Okay, so you were taking a later stage pregnancy or early or through the whole
I just
time?
had 1 cup.
1 cup.
1 cup. And then, because I grew up in the Virgin Islands, when I spoke to one of my family relatives,
Right.
they said years ago, pregnant women would usually drink stinging nettle tea the week that they're supposed to deliver, because it helps induce
them to
labor.
deliver. Okay. Not familiar with that. All right. Okay. Thank you. Anti-inflammatory, pain relief, arthritis and gout, expectorant, maybe respiratory, bronchitis, asthma, chronic coughs. Some have used it for hair, brightness, thickness, shinier skin, dandruff, eczema, a number of factors that may be related there. Okay, topically, of course, infusions, wash, compress for cuts, bugs, sprays, and all of that. Hair treatment, etc. Infusion, 1 to 2 teaspoons per cup. And juice, 1 tablespoon 3 times a day. Okay, can be stored in the refrigerator for 2 to 3 days. It can be preserved with what is called vegetable glycerin. Vegetable glycerin is a fat-like compound. It's used in herbal preparations. You typically wouldn't find that at a store or anything like that there. It helps to preserve things a little longer. You know what? I didn't intend to get this far, but being that we've got 2 minutes, we have questions, right? And so we probably want to answer some questions, and I'm going to go through this real quick. So it's anti-inflammatory, bronchodilator, carminative, diuretic, galactical. No, you don't have it. Okay, we're going to answer the question. Being that I tell you what, I'm not going to do that. Let's answer the question. Do we have questions?
Okay, one question came from the chat, Zoom. It says, how much honey do you take for asthma, please? How much honey do you take?
They have the handout there.
They should. It's in the handout.
The handout will give you like a typical dosage. If you go to the, I would not use it as a sole thing. Let's say you had honey and you had it in a tea, and you had one of the herbs we were talking about that helps with, respiratory or anti-inflammatory. I would add that to that. Maybe a tablespoon worth of honey twice a day, something like that. But I would add it to like herbal tea or something like that, but not necessarily just by itself. Okay?
Okay. I'd like to make a little comment as well that in a lot of cases, natural remedies sometimes react differently with different people. And so we have to be aware to continue to consult with experts, or don't give up your physician. We have to emphasize that we are not against seeing your physician and keeping in touch, but to stay healthy, to maintain good health, we have these tools that are vital for us and others. But self-medication is strongly discouraged. So just keep in touch with somebody who can help you, who studied and knows better. For example, consulting you or whoever else is a caregiver is recommended as well. We need to emphasize that.
Sure. I think I've said something about that. Yeah, it's important to be aware of all of these pieces and get advice. Most physicians, however, they're not familiar with the use of herbal medicine, and where they're more likely to say just don't use it. They don't know what it does, and they don't know if it really creates an interaction. So safety, they say don't take it. So talk to someone who is familiar with that. Okay, I'm trying to.
And sorry, while you're looking, before I give up the mic, another thing is that when we put combinations of things, because we see it on paper, but we have to be very careful about the dosages, and sometimes, say you would know sometimes what goes with what and how much, but part of the danger I find, and I've seen or heard of, known of people who privately self-medicate and they find different things that don't work well for their personal health, and people have died, so we have to be really careful.
Sure. All of this is important. And, get some feedback. You can send me an email or what have you. You have a question, you want to be really concerned. This is developing, right? This whole class. And so we get to a place where we talk more about application. But I'm talking about all of this. Now, next week is no class, right? You all should know that. So next week is no class. There is a break because there is another program that's regularly scheduled to happen in this facility, our community service. So you have an extra week. And so it's important for you to do what? To go over all of this, go over your next one, and review everything. I know I've been debating something. I'm not sure I'm going to do it, but it's the teacher part. We might, I'm not saying we will, we might have just one more quiz, and the quiz is based on all the previous quizzes. So all the answers come from all of the other quizzes. Feel familiar with you? So review everything at the beginning, because we may end up with just one more quiz at the end that's from everything you've done. So that's to encourage you to do what? To study, to review, to get it down. Yes?
Just want to say to persons that are watching online, some of them might be watching and they don't have the material. But if they send an email, to register, I don't want to say to register, but anyway, the material is available to them, so they're looking at I wanted to know these dosage for various things. It's stuff right in the material to help them to know how much to take for things instead of them second guessing, whatever. But the vast majority, all of this, they're registered, they should be receiving the materials.
Okay. All right. I'd like to thank you all for...
You ever look charcoal?
Oh, we'll cover charcoal at another time. Okay? So look forward to seeing you in 2 weeks. And we're going to cover 3 natural remedies in 1 class. All right? Let's have a word of prayer. Heavenly Father, thank you so much for this time. You've given us together. Help us to go over the information, the material, and be prepared to utilize it as a tool to benefit others. And in Jesus' name we pray, and for its sake, amen.